When it comes to scoliosis and not doing anything about the scoliosis, there are some serious risks associated with it. And one misconception out there is that, watching and waiting is actually a good thing when it comes to scoliosis, and it's just seeing what would happen over time. The three main risks when it comes to not taking care of your scoliosis is number one, and most obviously, is that there's very serious risk of curve progressing. Growth is the major factor here because as you grow, curves, or as patients with scoliosis grow, curves become bigger. And then when they become bigger, they become much more difficult to reduce. I always like to tell my patients that we have an average reduction of 30%. So it means for every 3 degrees that a curve progresses while you're waiting, we only can reduce 1. Progression can start causing to other problems. It can lead to more postural deformities. It can lead to more structural issues. It can also lead to degeneration as an adult, which we never like to see. And the more these things tend to happen, the more postural deformities we see, the more structural issues we see, the more degeneration we see, the harder it is to get a spine to actually change and reduce. Also, as patients wait and their curve gets worse, normally what we tend to see is that they wish they would have acted sooner. I never have a patient walk in my office, knowing they have had scoliosis for 10 or 15 or 20 years, now learning that their curve has progressed over a period of time. They're never happy that they did nothing. In fact, very recently, I had a patient that come into my office when she was much younger, 10 years ago, when she was 18. Her curve was around 40 degrees. At that time, she wasn't having any kind of symptoms or pain, so she decided to do the watch and wait. In our recent evaluation, we just noticed that her curve progressed to 59 degrees. It was 19 degrees of progression. And now she regrets not doing what she could have done 10 years ago. The longer you wait, the harder your scoliosis is going to be to treat across the board. So we recommend you take action, that you don't wait and let your curve get worse, where you're going to be regretting and wishing that you would have done something sooner.